Good afternoon. Thank you for joining us today. If this is your first time of joining me on this platform, my name is Chidebereze. On this platform, as I said before during my introduction, we discuss about important health issues, importance of exercising, and present issues. Now, today we have an important discussion which I want to lay bare so that everybody that is following this channel will get to understand it. It's an important health topic which most people misunderstand. So I feel that it's needful I talk about it. Now, you have to understand at the end of this discussion the concept of a toilet infection, pelvic inflammatory disease, and then subsequently we are going to talk about other abnormal vaginal discharge. Now, at the end of this video, you are going to understand what are the causes of a pelvic inflammatory disease, understand the risk factors, the symptoms, prevention and treatment, and of course the complications. Now, there are different things that can cause abnormal vaginal discharge, but that will be done in subsequent discussions. Today, I want you to understand that jargon of I'm having toilet infection is non-medical. It's not medical. It's either you have pelvic inflammatory disease or you have other things. Now, when people say they have a toilet infection, what do they mean in the real sense? Most often, we have found out that most people that have a toilet infection or the so-called toilet infection, now what they have is pelvic inflammatory disease or they have a bacterial vaginosis. Do you get? Now, what are the symptoms they usually present with those people that say they have toilet infection? They come down with abnormal vaginal discharge, come down with a lower abdominal pain. When I talk about abdomen, I mean here. Now going down this place is the lower abdomen. Something that I'll be using maybe some slide or projector so that you can understand what I mean by all those terminologies. Now, lower abdomen, they have pain there, or they have pain when they are passing urine, or they're having pain when maybe they are having sex or having intercourse with their partner. Do you understand? So now, going in detail, so you have understood that there is nothing like medical about toilet infection. There's nothing about it. So it's either you have pelvic inflammatory disease, just as I said, or you have other things. Now, going forward from this our discussion, what are the causes? What are the causes? Now, we know medically the major causes of pelvic inflammatory disease are bacteria, and the major bacteria that are known to cause these pelvic inflammatory diseases are the Neisseria gonorrhea and the Chlamydia trachomatis. These are the two major bacteria that are known to cause this pelvic inflammatory disease, which other people call layman call toilet infection. But for us, we know what it is. Now, what are the symptoms? What are the things that when you have it, these are the things you will be seeing? These are the things you're going to be seeing. The symptoms are, just as I said before, lower pain, lower abdominal pain. The person will be having serious pain in the lower abdomen. In the lower abdomen, that's called stomach. People call it stomach. That is lower down there. Before that point of where you have the private part, people having serious pain. Some will be having discharge, maybe abnormal discharge that is smelling, having some other like that. You get. So these are some of the symptoms. Maybe apart from the pain, people will have fever. Some will have pain when they want to urinate. Some will having pain when they are meeting their partners. Some begin to have alterations in their cycle. Alteration in the sense that instead of their normal flow that usually flow like 2-3 days or 4 days, they need to have like 5 days, 6 days, or may have like 9 days as case may be. Then people that used to have used to use like one pad, ladies that used to use like one pad, they begin to use like up to 4 pads per day as case may be. Do you understand? So these are some of the symptoms. Now understand that what we are discussing can also be involved in other people as well. Do you understand? So males can also have gonorrhea and chlamydia infection, but we are specifically talking about ladies, in other words female. Do you understand? So going forward now, we're discussing about the risk factors. The risk factors, this disease is common among young people. The adolescent and young adult, that's where you see it. So if you're a young lady, you're a young guy, you are at the risk of developing this disease because of the kind of lifestyle they live. Do you understand? So the other risk factors are when you have a male partner or a female partner that has any of these infections, you are at risk of developing them. There are some areas, demography, depending on where you are living, there are some residents that have that at high risk because of the kind of lifestyle in those areas. There are some states, for instance, in Nigeria, where HIV is more predominant. Do you understand? So these are some of the risk factors. Then, if you are engaged in multiple sexual partners, you are not faithful to your partner, or your partner is not faithful to you, you are also high risk of developing some of these diseases as well. There is a terminology that is called douching, whereby some ladies begin to introduce something into their private organs. Do you understand? So the douching, begin to introduce water, introduce some chemicals, pour cream and some other things into their body. These are some of the things that are also predispose you to having this infection. There are some people that are also on oral contraceptive pills, on oral contraceptive drugs. Some of them can alter your hormone. Following the alteration in your hormonal system, you can also develop this, because the tendency of getting infected is higher among those people because of the kind of life they live. So some of the complications that you may have when you develop a pelvic inflammatory disease, which some people may call toilet infection, and you have something that I call a pelvic abscess. Pelvic abscess. In the normal place where you are supposed to have the egg, or where the egg is supposed to pass, or where the baby is supposed to be, instead of baby passing through it, you need to have pus. That we're talking about abscess. Pus, serious pus. I will try as much as possible subsequently to kind of make a slide and project some slide so that it will show us what I mean by some of the terminology that I'm using. Pelvic abscess, you can browse it anyway. So when you develop this pelvic inflammatory disease, you can also have pelvic abscess, pus in your system, in your private part, inner private part. Subsequently, you can also develop adhesions, that is frozen pelvis, meaning that the different part of your woman's body, inside of your woman's body, where baby is supposed to develop from, will begin to come together and match together. You understand? Begin to have fibrous tissues holding them, grabbing them together. Do you understand? So these are some of the complications. Then from there, you begin to have chronic pain, chronic lower abdominal pain. So let's say I might be having this pain after I had discharge maybe 2-3 years ago. The person is likely developing the complications from that very disease. Some begin to have issues with conception, infertility issues because of poorly treated pelvic inflammatory diseases. So that is even one of the reasons why we are making this video, because most times people will say, some ladies will say, I have toilet infection. I have toilet infection. What do you mean by toilet infection? I have told you now that there is nothing like toilet infection. Either you have pelvic inflammatory disease, or you have bacterial vaginosis, or any other vaginosis. Do you understand? So that is what you have. So you should seek medical attention, seek for medical help. Go and see your doctor. This part of this video is not to tell you the drugs you're going to take. No. Part of this video, the major reason for this video is to tell you what you have, so that you can go and